What's happening? What's happening with him? How y'all doing, man? We had a little technical difficulties, but we still able to go live. What's happening with him? God dog it. Whoa, what's up, Lawrence Howard? What's up, my brother? What's up, Bobby Roy? What's happening with it?
What's up with it, boy?
How you doing, my brother? How you doing? Doing?
No,
Al, what's up, Al? I see you in the building. Bob, you know you ain't called me, though. When you called me, Bobby?
the man said just now, Earl, I called you. He just told you he called you. Who
And
believe
that's
the
why I
man
said
thinking?
when. All right. All right, Bob. Oh, look. I'm going to screenshot my call log. You screenshot your call log, and
Man,
I'm going to
listen,
see if you called me.
we don't need all that
What's
screenshot and
up,
all that. The
Bob? You
man
know I
said he
got to
called, he
fuck with
called.
you, dog. Yesterday? All right.
Don't
I'm going
worry
to hit you
about it,
up.
Bob.
I'm
I
going to hit
called,
you
I
up.
called too. He answered my phone call neither. So don't worry about it.
Don't do that, dog.
What's up,
What's up,
Ed?
E? Felice in the building. What's up,
What's up,
Felice?
Khalid? Man, I ain't been on this site so long. My head is too
Hey,
small.
babe. My
Mm.
babe in the building.
I need me a Vogue. Come on, Vogue. Give me some more damn head,
What's
man.
up, Sharon Moses? I saw
There she
you
go,
jumped
man.
in the building. What's up, Bubba Head? My dog Bubba Head in the building. What's happening, Bubba
What's up,
Head?
Bubba? What's up, Felice? I see you, Felicia. I see you, Miss Felice.
Say, bro,
I appreciate
it was that platform. What's up, Jenny?
it.
I saw Jenny, boy, 96 is in the building, dog. See, boy, I love the class support that I always get from my class. Thank you, 96, man. I appreciate y'all, man. I
I was
always
doing,
appreciate the constant support I get from class of 1996. You heard me? The best class to ever come out of Carver. I just want to put that on record. You see what I'm saying? What's happening? Oh, you went to hand makeup? That's what you want to show me?
I tuned you out, keeping my class 96 on the board. Listen, I ain't about no class 96.
Come on.
I'm in the building. My high two in the building. That's all we need to be in the building.
Say, bro.
Me, and you, your dog and your wallet too, sitting on 22s. Me and my chew gonna do.
What's up, Bert? I
What's up,
see
big
my
bird?
dog Bert jumped in the building. What's up, Bert?
Wow, what's happening with the bird? What's up, Ab? Man, let's see, Ab. I see Ab shooting 96 in the Felicia. Bye, Felicia. Anybody from 96 got cheated out their childhood. All y'all. From Earl on up to Felicia. All y'all got cheated out your childhood. Everybody just graduated 96.
Never before, never again. You heard, look, that's what's up, Sharon Moses. Never before, never again. You heard me?
I ain't
96,
never heard of her
baby.
before. She probably even go to college. She probably stuck her head in one
Hey,
class and
man.
dropped out.
That girl
I stuck my head
graduated
in
with
college
me,
in
dog.
96.
And
Yeah, well,
Felicia and Bert. You see what I'm saying? I can go down the list and Jenny. We in the building, dog. You see what I'm saying?
let
96.
me
And
see
my
now. What's up,
dog
Frizz?
Bubba here. We in
What's
the
up, Frizz?
building, dog.
Hold up.
We in the
Nah, don't
building. What? Bubba head 96. What's
pull the
that?
yellow pages out and call Carver Records and find out who Bubba Head when they know 96, Bubba probably in 86. Fred older than
Say,
me, I
bro.
think.
Bubba here right there. Bubba head represent right quick, man. So that boy was adding right quick, man. Put it into that Bubba head.
What's that say, Fred? Listen, I ain't listen, bro. No hate on Carver at all. I don't care 96, 92, 87, 1960, 56. I love my school, man. Yes, I love my school. I don't care when y'all came out. As long as y'all came out.
What's up, Colt? Courtney Burton in the building. What's up, big
What's up,
brother?
Courtney?
Yeah.
How you feeling, sir?
Big brother in the building.
My
Hey, I
head,
might need you tonight. I don't
I
know,
got a
bro.
half a,
Say,
I got a
bro,
half a head.
man, we running late, man. Y'all do us a favor, like and share. We got two awesome guests for y'all today. We have a great show planned for y'all today, man. You know, I can't wait to bring our guests on. I can't wait to bring them on. Like I said, we're gonna bless y'all today with these two guests that we have, man. That's why I say y'all do us a favor. Y'all like and share. Do us a favor and like and share. You know what I mean? Do us that favor. We appreciate it. You hear me? Y'all do us that favor, man. Like and share right quick. Hand
I'm in the
less.
bitch. I'm in the bitch shaking like a fucking Dotson.
What's up, Lil
Fucking grab on my
Terry?
shirt.
I see Terry Haynes in the building. What's happening with it, Lil Terry?
What's that, Terry? Look, cornet player. Look,
They
cornet
let
here.
that man play the trumpet, dog. That
They play the
man play the
cornet
cornet.
in the band. Terry the fucking cornet in his hand like that.
Hey, hey,
Hitting
man.
half a high notes.
Don't get Lil Terry started with all that, bro. You know the man played the trumpet, and you know the man played that trumpet. Don't do
Terry
that
was
to that.
good, dog. I can't take that from the Terry, but he was good.
Man, you know that man
We had
had his
some we had some dogs in the trumpet section.
on the real.
He probably was a half a dog, but he was a dog. Little trumpet, little body, big lips.
The man just came in the building, dog. That's how you
He getting
keep.
it too, bitch. It's get how you live Wednesday.
God damn it, dog. Why you so hard on our people, dog? It's Wednesday, bro. Everybody had a smooth day today, bro. You see what I'm saying? It's like, bro, let
Everybody.
them people finish enjoying their day, bro. What you drinking, my brother?
Um, this sir is I be juicing. This is watermelon, cucumbers, and lemon. Refreshing,
Mm.
refreshing. Good for the gut, good for the inside. Stay away from the cold drink. Y'all stay away from the cold drink. The cold drink gonna kill us in the long run.
Mm-hmm.
Some fresh juice, baby. Juice a little bit. The
Mm-hmm.
process is long. The cleanup process is longer.
Mm-hmm.
A lot of people like juicing because the cleanup process is no longer than the actual process.
Yeah.
But the funny part about it, people think lemons are sour. But when you juice them, they turn sweet. You know that?
No, sir.
You juice with lemons, they make it sweet. I just found out a couple of years when I first started juicing. Like, man, had no idea. But yeah, it actually turns sweet.
Mm. Like I said, yeah, I ain't had no clue, my brother.
Yeah,
I
start
ain't had
juicing.
no.
You can look like me.
Say that
And I,
again.
I had to go. I had to go fuss with my barber today because the cowboy law. Then y'all lose too. I said that's not the point. The point is you get to lose. I don't give a fuck about us lose by one. Y'all got ran the fuck over like
Say, bro, I don't care how bad we lose, as long as the Cowboys lose too. I feel a little better. I feel a little better. You see what I'm
that
saying?
boy told me.
Whew.
The good thing about us, we could lose 3 games till we put out of the division at 3-2. I just say if you want to think like that, that's sad.
Hey, bro, man, look, I don't like if they stop calling themselves America team, bro. I wouldn't have nothing to say about them, though, for real. And that is correct, Lawrence Howard. He does look
Listen,
like Black Santa.
I'm getting there, Lawrence. I'm trying. Dog. I got 2 months. My grandkids and take my this one. We have a black Santa Claus in the house for Christmas.
Oh, speaking of that, say, bro, y'all let them know, Kevin, let them know that we're gonna have a toy drive coming up pretty soon, bro, for Christmas.
Yes, listen, man. We appreciate y'all. Like y'all appreciate us. We'll have a toy drive coming for Christmas, man. Me and Earl trying to get together and get some dates lined up. Like I know we both work out of town. Earl closer than I am, but anything for our fans, we'll make
I
time to
didn't
come for
ask you that.
y'all.
Fuck you reporting that I'm closer than you. So what you trying to say that
I'm way up
that
north, dog. I'm way up north.
whatever? Keep talking.
I'm close to the Red River. You know where that's at. Anywho, um, but we want to come home and do a live show again in the city from our city for our fans, for our people. So we decided to come up with an idea for the toy drive. Donate a toy, get a show for free. You donate a toy, you can get in the show for free. Come see me, come see him. Act ass at the verdict. Don't have a date, so don't call us saying, where I get a ticket? We ain't got no date yet. We let y'all know it's out there. So if y'all want to participate, be a part of it, help the kids out, help yourself out. Treat yourself, don't cheat yourself. Come see us. Bring a toy, give it to the kids, and come see us for free. That's simple and plain.
It make a lot of sense, huh, Kev?
It makes some sense, you know. You helping 2 people out at one time. You having a needed child out, and you can enjoy yourself. You may come in there and see Black Santa Claus dressed up. You know, I might be Black Santa Claus. You never know what happened at the show. I'm telling you, Mr. Laszlo, y'all heard about it. Y'all been calling us. Man, no, don't call us next time. I'm telling you, you're gonna get doo. Care comedian not available. Don't call me talking about, oh, what happened at the show. I'm gonna tell you, yeah, you should have been there. I'm gonna do like the food stamp over through your ass. You miss your apartment call, you ain't get no fucking stamps. So y'all know how important them stamps is. We're important too. Come your ass on chair, sit in your chair, and come see us. If you call me, how the show went, it's gonna be doo. Here the comedians not available to talk to you. Now I'm showing up ass.
Kevin, how it's gonna go?
Don't call my phone talking about how the show went. I'm gonna tell you now. Your mama too. Don't I'm gonna tell you my mama don't call me talking about how y'all show went. You gonna be the same way.
What you say? That's for you and your mama?
Everybody.
That's for you and your mama. I'm not playing with you, neither your mama.
No.
Damn, Kevin.
Help the kids out, man. Help the
Yeah,
kids
bro.
out, man.
But like Kevin just eloquently just explained to you guys, yes, we are having a toy drive, and we will really appreciate it if you guys come out. We will also have a show, and like he explained, if you guys bring a toy, you get to get in for free. And like I said, is at the Verdict Lounge. How could you beat that? The Verdict Lounge got great drinks. We also gonna have a drink set up to what we gonna see. We got people that already been calling our hands on them drinks. So what
Yeah.
we gonna do is we gonna have a nice little setup. You know what I mean? And see as the show going on, who can take care of Mister the King and the Queen and the gangster
Yeah.
and everything
And the
else. You know what I
ball.
mean?
Yeah.
So
Soldier Slim.
right. So like that's the thought that we have. We always trying to think about ways to give back. You know what I mean? We fortunate, we blessed, and I'm not talking about just Kevin and myself. I'm talking about all of us. Okay, so we all are fortunate and blessed. So what we could do is put our little dollars together, buy a toy, because at the end of the day, a kid gonna benefit from it. You know what I
Right.
mean? So just pay it forward because growing up, someone always made sure that we had. So let's just pay it forward. You know what I mean? We would appreciate you guys come out, but we love it if you guys bring a toy or
Yes.
something that we can have to give away at the toy drive, and then you can feel like you was a part of that, and that
Right.
came from the All Love Over Here show, and that's us, not only just Kevin and myself, but y'all
Right.
too. You know what I mean? It's like without y'all, there's no us. You understand what I'm
Exactly.
saying? So we can't do this without y'all. So that's why we trying to tell y'all early, prep y'all early. Get your brain thinking like what you want to donate, whatever it is. We gonna say thank you, and we
Right.
appreciate it because we gonna give it to some kid. You know what I mean?
Right.
So just know that's what we doing moving forward. So yes, we gonna be begging for these little kids. Right? Donate
Yes.
something, man. Make a kid smile because everybody's
we
not as
got
fortunate as your kids.
we got one bike donated so far. Look, they donated before we even started. Got one brand new bike donated. It's a blessing. Listen, man, y'all all know where we came from, man. We came from the heart of the city, one of the roughest communities in New Orleans. But the best thing was about the Desired Project. We looked out for one another. Your family looked out for other people. We looked out. We still want that same camaraderie. We want to look out for other people that's not fortunate to have, man. And I said, growing up in the Desire, I learned a lot from the older people. They didn't care who you belong to. They'll tell your ass up, seeing back to who you belong to. And say, yeah, I beat his ass. He's running playing with the boys there, watching the window. And we gotta get back to that. We gotta get back to it. That's why they say, save us from us. We are our worst enemy, man.
Mr.
Not just
Kev,
ours.
stand up,
Save
Mr.
you want to see how small I am, dog.
Why the
Save us
fuck I
from
care how
us.
small you are? I mean, that shirt big. So what the fuck you
I
mean how
know. You
small
see
you
what
are?
I'm saying?
Big
Well, look,
ass
I
shirt.
got a,
That
I
bitch
got an
like it
eight pack
said, save us
from us.
from us and everybody else. Bitch, that
That's
bitch
been a
like got
billboard.
buku letters on there.
You know,
Say, bro,
we are.
I don't feel like playing with you right now. We got guests. I gotta get this show started. I don't feel like playing with you right now. Let's speak to who just came in the building, right? Then we gonna get the
What's up, little
joke of the
sister?
day
What's up,
out the
Patrice? Got a
way.
sister in the building. What's up, T? I see you, Pete.
Yeah. So listen, we're gonna speak to everybody, get the joke of the day out the way, because Dr. Michael O and his wife, Yes, they are in the building. So that means the show
Okay.
is ready to begin. All right, what's up? What's up? What's up, Brandon Williams? What's up, Bianca? How
What's
you
up,
doing,
Brand?
Queen? What's up, Patrice?
What's up,
I see
Patrice?
you.
What's up,
What's up,
Alicia? I ain't
Therese
seen you no more, Alicia.
Jefferson?
What's up,
What's up,
Teresa?
Andrew Wood? What's happening with it? Say, bro, I'm just gonna call you Andrew, dog. That Wood ain't gonna be We ain't gonna be doing that, Andrew. All right, Kylie Monroe.
What's up, Drew?
Hey, Auntie Jackie. What's up? What's up,
Hey, why ain't
Miss
you
Cal
showing? Hold
Ruffin?
on. I don't see you showing name on there.
What's up, Patrick Divas? What's up? What's up, Wango? I see you in the building. What's
What's up,
happening with it? How
what's up,
y'all
Miss
doing?
Tardy?
How
I see
y'all doing, man?
T
Y'all
Baby.
do us a favor, like and share, man. Y'all do us a favor, man. We really would appreciate it if y'all take this moment to like and share. Kevin about to get the joke of the day out the way, and we about to get the show started, man. So if y'all do us a favor, right quick, man, y'all take this moment to like and share. Hopefully, this information from the show can help someone. Maybe it's not for you. Maybe it's for someone else. So do us a
I
favor and like
say,
and share.
if I go back and I see nobody for class 96 sharing, I'm a dog 96 out next week. Since you brag on it so much. Oh, I said it out loud. My bad. I'm telling to myself. Sometimes I get like that. I got that direction. I got that Tourette. You know, I thought talking to myself for a second. So look, let me get this. Let's get this joke out the day out the way. So I was out doing some work. I ain't gonna say what I was doing, who I was fucking. They ain't paying me to talk about it. So somebody orders something from Walgreens, right? So I said, okay, damn, go pick it up for them, bring it to their house. So get to Walgreens. They say, oh, you looking for this here? I said, yeah, that's what I'm looking for right there. The morning after pill. I said, okay, cool. That's what that is. Cool. So I dropped it, run to the house, knock his somebody fussing, and go up to the door. They fussing, right? Yeah, call all kind of names. Yeah, you been going all night long. Just come your ass back home. I don't know what you been out there doing. I said, oh shit, somebody get into it. Heavy, huh? I said, what is going knock on the door? It's going to the same house. Knock on the door. Old man on the door up. Damn, old time, huh? So I'm saying to myself, I know Miles ain't never getting that this time of year, huh? So Pop come to the door. Say, I got a package from the He said, yeah, it's my package. I said, man, I ain't trying to get your business. I said, but you what you order, right? I said, yeah, I know what I ordered. I said, okay, it's a little more than that. He said, yeah, just been on out there all night long in the fucking streets. Then she don't coming in holding around and I ain't gonna take care of her. I gotta take care of her. I said, damn, man, your wife doing like that? He said, my wife? He said, no, somebody nasty ass dog of mine.
Ah!
But you gotta take care of your fucking 12 puppies. I think, sir, no problem. Make sure you y'all already know what it is, man. All love of this shit. I'm Kevin the leader. That's he got the creator. What you got for me, Earl?
Say, bro. I never would have known. That was about a damn dog. But as his big face ass said, y'all already know. That's Cab the comedian. I'm E Guyton the creator. Y'all already know what's the name of the show? All
Oh,
Love
love
Over
over
Here.
here.
The name of the show is All Love Over Here. And every week is our job to bring y'all an educational or entertaining show. All depends on the topic. If it's gonna be educational, entertaining. Today we got some education. We got some education for y'all, man. Look, I am proud to bring on this couple, this married couple, and both are doctors. I mean, these are things that we see on TV. These are not normal people that we see every day, husband and wife, black, you know what I mean? Both are doctors. I mean, this is phenomenal. And they are well educated, man. I can't wait to bring them on to talk about our topic for today. The topic for today is okay, someone wrote me a letter, and honestly, and I'm gonna be real honest, I didn't want to do the pepper letter, but I did want to address what was in the pepper letter, right? But because it was so disturbing to know that we have kids that's teenagers that's smoking weed and popping pills while they're pregnant. like I just don't understand this. You know what I mean? So it was her letters was titled, how do I convince my teenage daughter and niece, not one but two, my teenage daughter and niece to stop smoking weed and popping pills while they're pregnant. You know what I mean? So it was disturbing, bro, because like they don't even understand the effects that drugs is having on them and the baby, and it's seeming like they don't care. So I didn't want to go through the letter and us go through the shame and the blame. Nah, man, that just get to the meat of this. So I'm gonna bring on Dr. Michael O, because due to time constraints, we lost a lot of time and we don't have one for long. So I'm gonna bring Dr. Michael O on first. His name is Dr. Michael O. Koranko, but we call him
Don't.
Dr. Michael O for short on the All Love Here show. So Dr. Michael O, you ready? I'm ready to bring you on, my brother. If you're ready, I'm ready to bring you on. Let's get Dr. Michael O in the building, man. Like I,
Yo, he was chopping off the man last night. I damn sure I can't.
yeah. Yo,
Oh,
yo,
Hey,
yo,
what's
yo,
going on,
yo.
fellas? Hello,
what's up,
hello. How
Doc?
y'all
How you
doing?
making out, man?
What's
Long
up?
time,
Yeah,
long
What's
time.
up,
wonderful,
dog?
wonderful, man. Hoping I don't get the Beyonce traffic tonight at the hospital.
Oh,
You know, I'm on that
I
9 o'clock,
forgot.
so
Hey,
it's all
hey,
good though. It's
hey,
all good.
bro.
But thank y'all for having me on.
Say,
Appreciate
bro.
you coming on, man.
Thank you for taking time to come on. Like I said, I appreciate you being a friend of the show. You heard me, so you our resident doctor whenever we have medical questions. And it was awesome to reach out to you and to see that you had some assistance, and the assistance was your wife.
For sure.
That's why I said, right, man. What y'all have going on is a beautiful thing, and that's why I said, so congratulations on that, man.
Thank you, thank you.
Um, Right. Did I pronounce your last name correctly?
Yeah, yeah, it's fine. I go by Dr. Mike though. That's what people know me as.
All
So I
right.
keep it simple.
All right.
Yeah,
Yeah,
simplify, cause that last name
yeah,
hard to
yeah. I
believe.
just keep it simple.
Yeah, yeah. And then that's why I was like, okay, I'm gonna try to pronounce it and see if I pronounce it correctly. But you Dr. Michael O on the show, so
Yeah, yeah. I
yeah.
would like that too. Whatever
we,
works, It's all
right.
about
Dr.
the
We,
message.
Eyes.
we give you names around here. This New Orleans, you heard me. You already know that.
Yeah.
Say,
Ain't about
bro.
me, it's about the message. Yeah.
Hey man, but you heard the topic, and I repeat if you didn't hear it. The topic was, how do I convince my teenage daughter and niece to stop smoking weed while pregnant?
Mm.
You know, the effects that have on you. I want you to go in more detail about it, but we have questions that we're gonna ask you just to kind of lead up to some answers that a lot of other parents may be looking for at this present moment. You know what I mean? By
Mm.
you working, you mainly work in emergency
Yeah,
room?
only. Yeah,
Only, only,
yeah,
only.
yeah.
Okay. Tell me this. Um, do you have patients admitted for severe drug issues? Is that a real thing going on right now where they come into the emergency room for drug problems?
Oh yes, that's a real thing. I mean, just yesterday, I had someone with a heart attack, just due to coke. You know what I mean? Not like a heart attack. You know what I mean? Related to like blood pressure or diabetes, anything like that. Just strictly off of a little coke or whatever, and it resulted in that. So yeah, we see it often actually. Pretty much daily.
Wow.
Yeah.
What was the age of that
Yeah.
person?
Yeah, young person, anywhere between 20s to 40s, so kind of outside the age you would expect like a real heart attack to happen. Normally you would expect that like in a 60-year-old, somebody who's been having high blood pressure for a while. But the thing about it is some of these substances can like just change all of that and like result in having some of these things at young ages when, you wouldn't expect it to happen, but it definitely does happen.
Hmm.
Wow.
Yeah.
What's the ratio men to women that's admitted to the hospital due to drug abuse?
I would say it's about equivalent. I can't necessarily say that I've seen a real difference in terms of a demographic, but it's super often. I mean, often there's women, just as like there's men. So I don't really notice a big difference with regards to that specific question.
Mm. Go ahead, Kevin.
Dr. O, I got a real quick question for you.
Okay.
Um, can a baby be affected if the father is doing weed or popping pills and not the mother having unprotected sex?
Oh, for sure. I mean, that's a real thing, and it's so hard for people to truly understand it. It's kind of like that thing, the stove is hot if you touch it, or the stove is hot because it's hot. And it's one of the things that, because the mother may not experience the effects of the drugs or whatever, but 9 months later, you can have a baby who's stillbirth or has complications in their childhood and even for life, just as a result of the mother while pregnant, using some of these substances. I mean, it's a big red flag, and we give guidance to patients who are pregnant on the risks associated with drug use, because it's fairly often that I manage pregnant patients who may do some of these things, and it's really hard for I guess a mother to truly understand it. And I understand why, but it certainly is a challenge.
Hmm.
Go ahead, Kevin.
What's the most common pills being used that you see coming through the ER now?
I see. Well, what I normally deal with is a lot of crack cocaine. There's a lot of fentanyl. Uh,
Wait. Time out. They still got a lot of people using crack.
oh yeah, oh yeah.
Wow.
Mhm.
I thought crack was
What's the age of the people that's using crack? Is older people or is younger?
Us, I would say it's probably 50 and above. That I tend to see that particular substance with. But really, I'll say the common thing across all ages is probably some form of opiate, fentanyl, or something like that. You get a lot of that. But I would say those are probably the two biggest things that, and I see, and oftentimes a lot of people don't actually, they think they're taking one thing, but, you know,
Hmm.
they come to realize that they took something they even knew they took. So that's often an issue as well
Mm,
in the fentanyl.
Wow. I thought crack cocaine was out the window.
Yeah. Hmm.
Because I
yeah,
haven't seen nobody on the corner ice on the coach.
Yeah.
I haven't heard nobody say about they buying crack with pills.
correct. And
Yeah.
that's why I asked, like, what's the age? You know what I mean? Because I want to know, what do we have, like, younger people that's getting on crack, or
I
you know
see.
what I mean?
Now, I think I mostly see that with, like, the older population. Sometimes, I just straight up ask them because, depending on what it is, you treat differently. And so they'll just say crack or whatever it is that, they took. And I get that information the safe way, you know what I mean? Not to implicate, just so I
Correct.
can know how to treat.
Right.
So, yeah,
Correct.
Wow.
yeah.
Wow.
What's the youngest person that you saw since you've been there that come in that had to be treated for some type of drug abuse?
Uh, Pediatric. I mean, the teenage population for sure. That's not uncommon at all. Because the thing about it is, a lot of these substances, they result in like medical emergencies that need to be dealt with medically, and so as a result of that, they come to the emergency department, and not necessarily children's hospital or any pediatric hospital. They just get to the nearest hospital that you could save a life at. So yeah, teenagers for sure I've seen. That's not uncommon at all.
Mm.
Man.
So what's the drug of choice, in your opinion, that you see? What's the drug of choice you see right now?
Oh yeah, for sure. It's fentanyl definitely. It's that you give a lot of Norcan. I think you could actually get that over the counter, the reversal agent to that. So, or any form of opiate, but often it's fentanyl. I would say that's probably one with the most devastating effect. But obviously THC is probably most prevalent, you know. But I would say the most significant is probably fentanyl.
Um,
Wow.
Go ahead, Kevin.
Real quick, I haven't heard someone say this, man, but why are some expecting mothers does not think that this is harmful to smoke weed while pregnant?
I guess just because of I guess the idea that in particular, weed isn't harmful. But I will say, in the setting of being pregnant, there's just a lot of more sensitivity that needs to come with what could be harmful with that, because it is a form of smoke in and of itself, which that exposure to smoke results in compromise or some abnormalities to kids, and so to fetuses. And so I think just that is a challenge, and also because maybe the mother doesn't experience any negative symptoms, so it's hard to imagine that her unborn child would. And so
Gotcha.
yeah, it's just a concept that's really, really hard to get people to understand that could be significant. And I think my wife will have a lot more insight, because she speaks with these patients day in and day out
Right.
as an OBGYN. So be interested to see what she has to offer with regards to this.
I'm gonna ask her because I really heard people say that, and I was like shocked, like, huh? But people really think that weed ain't gonna do nothing to my baby. I'm smoking weed the whole pregnancy. Like,
Yeah,
that's not true.
yeah, it's not true. It definitely is a risk. It definitely is a risk for sure. Yeah.
Mhm. You know, with these kids just doing these drugs, we have television, these programs on TV, the internet. I mean, it just make it seem like it just the norm,
Hmm.
right? And it's just a cool thing to do because
Hmm.
the rappers doing it, the
Yeah.
artists doing it, your favorite
Mm.
artists doing it, no matter if they're rapping, singing, or whatever they're doing. You know what I mean?
Hmm.
Unfortunately, they won't do what the adults are doing.
Hmm.
I think a lot of that have an effect on what these kids are doing now today.
Yeah, for sure.
You know what I mean? Do you think, like I said, the entertainment industry have a big effect on these kids using drugs?
Unfortunately, yeah. I can't necessarily say I blame on the industry. It's just an unfortunate result of the entertainment industry, and it's also an unfortunate result of the entertainment industry also maybe not also, I guess, keeping it real in the sense of really informing people what could be harmful um, of whatever it is that they expose the audience to, just as much as it's entertaining and exciting for us. Just kind of giving us both levels of understanding. And so yeah, without a doubt, unfortunately, that's just a byproduct of that, and it's really hard to sift through, especially as a young person, to truly understand what could be negative from what it is that also excites me. So it's just a difficult and unfortunate phenomenon.
Mhm.
Mm.
Okay, audience, this is the time y'all can start asking y'all questions to Dr. Michael O. We only have him for 4 more minutes. That's about it. Be blessed to have him for 4 more minutes. So this is the time to ask y'all questions. Kevin, go ahead.
I got two questions from the audience, Dr. O. One
Okay.
of them, do you believe, why do you believe that they're lacing weed?
Why do I believe that they're lacing it?
Yes.
Unsure. To be honest with you, I would imagine that people have, however it's distributed, their secondary goals in terms of just trying to maximize whatever benefit that they can get from maybe giving what is not, what, selling or giving, things that aren't necessarily what the person who's getting it thinks that it is. And so I would imagine this has something to do with just trying to maximize whatever profit or benefit that someone can get. So you just, you just kind of water down whatever it is
Right.
that, that type of phenomenon, you know what I mean? Without, just trying to, watch my words here. But I think it has something to do with that.
Okay. Another question from the audience, Lawrence Howard wants to know, can weed cause them to lose a baby?
I don't think I don't think there's evidence that says that weed will not result in you losing your baby. And I think that's enough information to just, you know, have cause for pause and to not even expose yourself to weed, because I don't think the science out there knows for sure that weed won't result in you losing a baby. And because they can't say that it won't, I think that's enough information to just make sure the baby is as safe as possible and to stay away from marijuana.
Mm-hmm.
Gotcha. Gotcha.
Okay, this is the last question right here. Any suggestions for the mother to tell her kid and her niece? Any suggestions you can tell her right now?
Wow. I would say use the internet. Really, um, gain some understanding or like use examples of what went wrong as a result of a mother using substances. Show that picture to your niece or whomever. In other words, just have a visual representation of what could go bad as opposed to just using words. And the easiest way to get a visual representation is to maybe access that information online. Googling it, there's going to have some pictures, maybe of some stillborn, unfortunately, some stillborn kids that can be shown to to your niece just to let them know, like, look, this can happen. I think that, will pay dividends because it's really hard to just say it verbally.
Hmm.
Mm-hmm.
Gotcha.
Okay, okay. Hey man, I really appreciate your time, brother. I know
Thank
we
you.
didn't have you too long, and I thank you for having patience with us while we was having internet issues. So thank you for your
Okay.
patience, man.
Thank
If your wife is ready,
She
we
is.
ready to bring her on. She's ready.
Yeah. Thank
Okay.
y'all.
Hey
Thank you,
man, well
Dr.
I
Y'all be
O.
awesome.
appreciate you, man.
Y'all be well.
Hey, hold
All right,
up,
man.
hold up. You know how this goes.
What's
Don't
that?
go nowhere, man.
What's that? What's
Look,
that?
the name is the All Love Over Here Show, Brand. When we
Yeah.
bring you on, we bring you on to show love. I don't bring no anybody on this platform. So when you
Yeah.
come on, bro, like I said, we gotta clap you up. So thank you, my brother. Let's
Yeah.
clap him up,
For sure.
everybody. Let's clap him up. Let's clap him up. Let's clap him
Yeah.
up.
Hopefully you can beat some of that traffic up from the Beyonce
Hey,
concert.
I know, right? Hopefully.
I'm gonna let you get out here, but like I said, thank you for your time,
Man, we
brother. We really
salute you,
All
man.
right.
appreciate you.
Y'all be
All
well.
right,
Thank you.
no
All right.
problem, brother.
Yeah.
I should go to the concert.
All
Beyonce,
right.
Beyonce charging house mortgages and car notes for them concert tickets.
Oh man, say brother, I know the look the city packed for that concert. I know
And
the
then
city is
she
boy, look, that's
she do she
Beyonce.
yeah, she do two songs and Baby Blue Ivy do five. And then they go on stage together.
That
You pay for Blue
that's
Ivy concert.
Beyonce. Dr. Remy, if you're on here, I'm ready to bring you on, Dr. Remy. If you're on here, I'm ready to bring you on, Dr. Remy. Say, bro, Beyonce bring them out, boy. Beyonce bring the city out, boy.
Boy, Beyonce been a worldwide city tour. She's been Houston, Dallas, New Orleans. She was 2 days in Dallas, 2 days in Houston, 2 days in New Orleans. Like, man, that boy
Dr.
Jiggle,
Remy.
he gets hair twisted or something. All the damn money she trying to make.
Man, y'all do us a favor, like and share. Dr. Remy.
How you doing, Dr. Remy?
How are y'all doing?
I'm
Hello,
doing fine.
hello. Hold up. Well, I ain't gonna talk about your internet because we had internet trouble, so I'm gonna let you slide. I'm gonna let you slide on this. We
About to
usually
say, boy, she got that T-Mobile home in the net.
hey,
Oh,
look.
Cox problem.
Yes, yes, yes.
Dr.
Thank you.
Remy,
Appreciate
hey,
you coming on.
I
No,
appreciate you. Thank you for making time to come on, Dr. Remy. Um, I have this topic, and I was talking to your husband about it, and to hear you are OBGYN, I just got that together today. I was messing that up forever.
Boy, who?
Yeah,
Me
that
and you
means
both.
look.
Well, I call it ozone. So the ozone
Right.
doctor.
I mean, to hear your OBGYN, you can perhaps give these young ladies better insight, advice on what could happen, what the effects, and let me properly introduce you. Your name is Dr. Remy Omotayo.
perfect. Yeah.
Boy,
Look,
listen.
man,
You better
I
than
was looking
me.
at it like, look, I'm gonna take my time and pronounce it right. So, Dr. Remy Omatayo, man, you are Nigerian by background.
Mhm.
You was raised in
Ah,
Tallahassee, Florida. Dr. Remy is a practicing OBGYN in the greater New Orleans area and enjoys being an advocate for women's health. I mean, so let's welcome Dr. Remy on. Let's clap her up. Let's clap her up. Let's clap her up. Let's
welcome,
show her
welcome,
some
welcome.
love. Hey, Dr. Remy. I appreciate you. Like I said, once again, man, I appreciate you coming on. I'm not gonna have you for long, but we do have some questions that we're gonna ask you pertaining to the topic. And the topic is, how do I convince my daughter and niece to stop using drugs, meaning smoking weed and popping pills, is what she said,
Okay.
while pregnant, right? So that's the topic, but we have questions that we're gonna ask you to help the audience better answer some questions that they may have, right?
Sure.
Um, initially, like I said, with the drug use and it being females, in your opinion, why are so many females using drugs now?
I mean, I think that's a hard question to answer, but I think at the root of it is whatever, social determinants of what's going on in their lives that makes it more likely for them to use drugs. Oftentimes people use drugs as a like self-medicating thing. So there may be some pre-existing stressors, or they may have anxiety or depression. That's what they turn to try to numb the pain. So I think at the root of it, most of the time, there's a pre-existing either mental health issue or just the circumstances of life, and not having the support that they need in life to have healthy mechanisms of coping with the stresses that go on. I think that's probably the top reason.
Mm,
Wow.
go ahead, Kevin.
Um, what are some of the effects that the drug can have on the baby?
So it depends on what they're using. As has been said earlier, it's very common, most commonly is opioid use. So that's either fentanyl or heroin or oxy pills. Those tend to be the most commonly used. And those you can have there is risk of stillbirth or losing a baby within pregnancy. There's risk of preterm labor, having a baby too early, baby being born at a smaller weight. Can affect their development while they're pregnant. And then after pregnancy, when they're delivered, basically thinking about pregnancy as the baby is getting all of its nutrients from the mother. The baby has no other outlet of nutrients. So whatever you put into your body is going to your baby. So if you are addicted to drugs, then your baby is going to be addicted to drugs. And so when that baby is delivered, they often have to spend some time in the NICU being weaned off of whatever drug you have been using because the baby is used to that drug. And that can be a very challenging thing for the baby. Babies can come out very irritable. They can have poor feeding. It really delays those early milestones that newborns need to make in the beginning of life because they're so hyper focused on weaning them off of those drugs. So those are a few of the side effects of that.
Gotcha, gotcha.
Wow. How do you treat or administer aid to someone that's pregnant that's smoking weed? Like you say, what if they are addicted to it and they've been doing it all the time? I mean, what do you guys do? How you administer aid to someone like that while pregnant?
Mhm. I mean, we always try to just educate them. A lot of people, I think weed is so normalized as, it's the commonly used drug, right? And outside the to some people may not be as big of a deal, but because it's so normalized outside of pregnancy, I think that patients try to apply that to pregnancy. But the fact of the matter is, we don't have enough evidence to really say that it's not harmful. And so I think just starting with educating them on the potential risk of using marijuana in pregnancy.
Mhm.
Um, and if y'all ever have questions, don't hesitate to ask your OB about what these effects are. But it's and that it can affect how your baby grows while you're pregnant. It can affect you going into labor earlier. It can, which then will cause your baby to be born at a lower weight. It can actually cause developmental delays, like with their brain and how they grow and learn, and cause like behavioral issues as they grow up and develop after birth. So there's all of these effects that I don't think a lot of people know just because of how normalized using weed is in general. But these are all things that you can talk with your OBGYN about if you have questions to explain. I feel that knowledge is always power. So if you don't know better, then you won't do better. But
Right.
that if you have a physician that's patient with you and can explain these things, I think that's a good place to start.
Right. Right.
Good, Kevin.
No more questions for you, doctor. Oh, I actually husband the same question. But I don't know if he understood what I was asking him or did he answer it correctly. Because some women out here believe that this is not true. But if the father is doing drugs and they're having unprotected sex, could that still harm the baby? Not
Like,
the mother, just the father by itself. But the mother's not doing it, just the father's doing drugs.
uh, so
Like
if
weed or popping pills, something like that.
protected sex with the mother while they're doing drugs, can that,
Right.
and the mother is already pregnant,
Yes.
that directly wouldn't harm the baby, just because there's not any cross sharing of like blood per se. But I will say the same thing applies like with smoking marijuana, like how I'm sure you've heard of secondhand smoke, like with cigarettes, right? So if your partner is smoking weed around you and you're not necessarily smoking weed, but you are pregnant, still susceptible to those side effects, even though you're not directly smoking it because you're still inhaling the weed, essentially.
Right. Gotcha.
So not direct uh, intercourse, but they are smoking around you, similar to if someone were smoking cigarettes around, that could be a potential risk.
Mm. So for clarification, all right. So if a female is pregnant and she's having sex with a guy that's doing drugs, that her having unprotected sex with him cannot harm her baby. Is
Not
what you?
from the standpoint of drug use.
Ah,
Now, if,
okay.
but that does open her up to, if she's not familiar with the partner, if they have pre-existing STDs, like gonorrhea, chlamydia, syphilis, and she's having unprotected sex, then that is potentially harmful because then she can contract that. But as far as the effects of using, not using through intercourse, that's a relation.
Mm.
Gotcha.
What are the short and long term effects of constantly popping pills just for a person, period? A person that constantly pop pills, let alone being pregnant. But what are the long term effects of that?
I mean, I think that leads to the long-term effects of addiction in general, where the priority in your life, when can you get high next, rather than the other things that you could be doing to grow yourself as a person, to grow in your career, to develop your family. People that are addicted, unfortunately, the most important thing that becomes important to them is the next time they can get their hands on some pills. And I think that in itself is very destructive to life in general. Destroy the goals you have, it can destroy your relationships with friends and family, and devastating. Apart from that, neglect other areas of your health. So as an OBGYN, we find that patients that have a long-term history of addiction, they're not coming for like their checkups, and these are the patients that show up, after they've gotten clean 10 years later. But now we discover that, they had a pap smear time, which is a screening for cervical cancer, and they end up showing up with cervical cancer because they haven't been to the OBGYN in like 15 years. And so it can be pretty when you're not on top of your health and you're not checking in with the doctor regularly because your life has been consumed by addiction.
Right.
Mm. Go ahead, Ken.
I got a question that's off the topic. Um,
If
let's
you
see
got
here.
something off the topic, you don't got nothing from the audience that's on topic. I'm sorry, Dr.
Somebody
Michael
got
O.
listen.
This is the type of shit
Hey,
I gotta
listen,
deal with.
listen.
He just
Somebody asked
gave
me a
me a fucking
question.
warning that he about to don't do this while we got company, bro.
Somebody got asked me a question. I don't think it's on topic. To me,
Stay
it's
on
not.
topic. Stay on
Let me
topic.
see what the audience got.
Right.
Oh, here we go right here. So, hold on, I gotta scroll down some. Okay, Ebony wants to know Ebony Watts wants to know that any kind of rehabilitation offer for pregnant women that's on drugs, pregnant moms.
Yeah, I'm familiar with a place called Odyssey House,
Okay.
that I think they do drug rehab. The challenging thing with pregnancy is that a lot of these rehab centers may not take you because you are pregnant.
Okay.
Um, and the thing about being addicted to, we'll say for what's most common are women that are addicted to opioids. And in pregnancy, we don't actually recommend like weaning off of opioids cold turkey while pregnant because those effects can be more detrimental than staying on a medication where replace we basically block the weaning of the opioid. So if you're like addicted to heroin, we would put you on a medication called Subutex, which basically is to help limit your cravings while you're pregnant. And the goal is to basically prevent you from using drugs while you're pregnant by continuing you on this medication. And this is usually managed by a psychiatrist. And so we would maintain you on this medication throughout your pregnancy. And the goal is after you're pregnant delivered is to then completely wean you off of that through a psychiatrist and through the help of counselors. But during pregnancy, it's fairly safe to go, cold turkey, just because most of the time we've seen it just leaves mothers in a very precarious situation and they just end up going back to using, and that can be more harmful than just maintaining them on a drug that can help their cravings and kind of prevent that process until after they deliver.
Gotcha. Also from the audience, Dr. Remy, are you obligated to report drug uses?
Um,
What?
what?
Somebody said, are you obligated? Are you? Let me see. Hold on, make sure I read that right. Are you? Hold on, maybe I lose it. Okay, here you go. Are you obligated to report drug use? I don't know. That's the audience asking me a question.
I'm not personally obligated to report it, as in assuming they mean like reporting it to the police. I'm not obligated to do so. It does become tricky with when you have a child, so that's more on the side of pediatrics, because
Okay.
if at the time of birth, if they find uh, signs of drugs in the baby's bloodstream, then the baby's doctors will likely contact Child Protective Services, and that will have to be worked up as an investigation. But me myself taking care of pregnant patients, I don't, I'm not obligated to report that to like any police officer or anything. As a
Yeah.
as a doctor, I will encourage you to not, and I will get the resources for you to help, cut back on whatever drugs you're using and get you to OB. We have OB psychiatrists that kind of help with our patients that do have drug addiction to kind of help support you through the pregnancy. But as far as reporting to police, we're not obligated to do that.
Okay. You got another question, Kevin, from the audience?
So when I see on my side,
Okay, I see one right here.
okay.
Durance asks, "Do you believe the weed have chemicals in it? Also, what side effects do they have?"
The chemicals in it.
Yes.
Um, so weed, I'm not really too familiar with the makeup of weed, but as the side effects of weed, of smoking weed or marijuana in pregnancy, it can cause delayed growth. It can cause the mental issues as far as how their brain develops while pregnant.
Kevin, you
It can
want
Right.
mute? You want? I'm sorry. I'm so sorry, doctor. Look, Remy. Kevin, you could have been muted it, brother. You couldn't hear what she was saying. Please forgive us.
It's okay. It can cause some learning or behavior delays, like after they have been delivered. There's a risk of stillbirth, there's a risk of preterm birth or low birth weight. So there's different side effects that aren't, it's not too well studied, but our recommendation is to refrain from use of marijuana in pregnancy for those reasons.
Okay, one more question for Dr. Remy. Do we have one more question for Dr. Remy? We really appreciate your time. Thank you, thank you. You've been rolling with the questions, and none you wasn't stuck on none. You was ready. I mean, look, you came with your guns loaded. You know, do we have any other questions, Kevin? All
Nope, I
right.
can't see no more.
You- all right. Kevin, what you want to ask Dr. Remy?
I don't know. I was reading the audience. You said read the audience. I read the audience.
Okay. Hey, I know you wanted to ask something that wasn't on subject. I don't
Y'all
know
get patients
why.
high chew. I need a high chew. I come see the doctor. So, listen, y'all give out high chews. I ain't coming to see no OYGB and all that kind of stuff.
Well, won't actually see, so.
But I did want to ask a serious question about your profession. I know you say the skill, the profession that you are in. Also, I can ask you no questions off the grid. But this might be important. Somebody might not know this. Um, what is BRCA and how does generic testing help women?
So, BRCA is a syndrome that puts you at a higher risk for breast cancer, and it is inherited through genetics. So, and then what was the second part of your question?
On how is generic testing helpful?
Oh, okay. Yes. So essentially, patients that have breast cancer or have a strong family history of breast cancer, we always recommend genetic testing because it can essentially save your life or prevent you from developing breast cancer and having to go through all of those treatments and management later on in life. If you are someone that has a personal history of breast cancer or a strong family history of breast cancer and you undergo the genetic testing and end up having the BRCA gene, um, what it means is that you would talk with your OB/GYN doctor and they would recommend certain risk reducing procedures. So the gene itself, it puts you at a higher risk for both breast and ovarian cancer. Um, Also, there's other cancers like prostate cancer, um, pancreatic cancer that you can be at risk for, but that's at lower risk of the BRCA2 gene. But the main cancers are breast cancer and ovarian cancer. For breast cancer prevention, we would recommend what is called a mastectomy, which is removal of all breast tissue. And for reduced risk of ovarian cancer, we would recommend removal of your ovaries and your tube. And we usually recommend that after you are done with childbearing, because you can't get pregnant without your ovaries. But for the BRCA1 and BRCA2 gene, we usually recommend that at the age of 30 to 35 and then 35 to 40.
Okay, we do have another question. With these babies starting on hard drugs and pills so early in age, does that put them in higher risk of being sterile?
Of not being able to get pregnant.
Yeah.
Um, I don't know that there's enough evidence to say that for sure. I think that being on drugs can reduce your ability to get pregnant potentially. But I don't think there's evidence to say that it will make them sterile and that they can never have children. I think overall, and someone that desires to get pregnant, focus on making sure that you're in the best healthy state as possible, and that would include refraining from drug use because that's not consistent with good health.
Mm, okay, okay. Hey, ladies, we got an OBGYN on. I mean, do y'all have any other questions for while we have her on here? Kevin wanted to
You
know.
welcome, Sabrina. Sabrina said, "Great question, Kev." You so welcome, Sabrina.
But Kevin, you also had another question. Kevin want to know why his menstrual be down so long.
What? Um, you got to excuse him. Every now and then he tried to take somebody else's job on the show, but that's not his job. Um, I did have another one. I can't think right now. Oh, what are some of the vaccines women need to take to stay healthy?
That they need,
Vaccine, yes,
what are some vaccines that they take?
yes.
Um, is this specifically just in general or for pregnancy?
Just in
General.
general, just like women in general.
I think apart from the vaccines that are recommended just as that the ones that you get as a child, I think the main important one that we recommend is the HPV vaccine, which is also known as the Gardasil vaccine. And that is primarily to prevent cervical cancer. So HPV is a virus that is sexually transmitted. It's so common that we don't generally like treat it like it's a STD like gonorrhea or chlamydia, but it's very common, and it is um, one of the viruses that is very high risk for development of cervical cancer. So it's very important to get your cervical cancer screenings, but the vaccine, it covers the high risk strains of HPV, which can then hopefully limit your risk of developing cervical cancer in the future. Apart from that, we always recommend the flu vaccine in pregnancy as well as the COVID vaccine in pregnancy because pregnancy is a immunosuppressed, or basically your immune system is lower than what it normally would be, so it's harder for your body to fight viruses. So we always recommend those two vaccines in pregnancy.
Great, great. Okay.
Okay, that's the last question. Don't look for another question. She gotta go. So we appreciate you, Doctor O. Dr. Remy O. Let's clap her up. Let's clap her up, everybody. Let's clap
How you
her
gonna
up.
let her leave? She might
Let's
want to stay
clap
on
her
all
up.
day.
Let's clap her up. You did a great job, an awesome job. Just like your husband, you now is friend of the show. So when we have questions, man, look, honestly, having you guys to be able to lean on when we have questions, it is awesome, and we really appreciate it.
Yes.
Seriously, thank you for your time. I know you are very busy. You know, that's why I wanted to make sure that I let you know that hey, you a friend of the show now. So when we call you, I'm be calling you and look, y'all can just put me on speakerphone because I got a question for y'all. So once again, man, thank you, thank you, thank you. And this is what we do when you bring you on the love all when we bring you on the all love over here show. Brr, we gotta make sure we thank you and clap you up. So that's what we're about to do right now. Let's clap up everybody and
Show
thank
some love, man. Thank you for coming on. Thank you for coming on.
thank you. Thank you once
Look at
again. We'll be
my
calling you
chicken.
again.
Thank you. Thank you for having me.
No problem. Bye bye.
Salute. That was good. She got a lot of information.
Courtney, is Courtney on here? If Courtney Burton, Courtney, you on here tonight?
Courtney.
Where's Courtney? Courtney, if you on here, Courtney, I want to ask Courtney some questions. Courtney, there
I
we
didn't see
go.
Courtney in the audience.
Courtney here. Courtney, I need to ask Courtney some questions because when we was talking to Dr. Remy, yes sir, Coach.
Was that
Hey,
in the E?
What's
hey,
up, Courtney?
Was
my
that
dog.
in the
What's up,
care?
big brother?
Nothing
What's
much.
up,
How
big
you
brother?
doing,
How you
sir?
doing?
Man, you know, bro. I'm out here chilling. That's about it.
Hey, bro. All right. Number one, bro. Look, I'm pulling you in right now because I feel like you'll be perfect. Oh, that's grandbaby.
Yeah. You know, that concert done ran everyone out. So now look.
Hey,
Hey,
grandbaby.
Say,
Kia.
say hey
Look,
low.
I got
Hey,
my candy too.
beautiful.
Now move. Move.
Yeah.
Move low.
That's all right, man. That's it. Let her
Yeah.
get her time, bro. Let her get her
All
camera
right.
time, man. How you
Hey, how
doing?
you
You
doing?
put the phone on her face, cool. You can't see her.
Oh,
There we go. Hey, beautiful. How you
Hey.
doing? What's your name?
Say, Lauren.
Lauren KS.
Girl,
Wait a
stop.
minute.
Stop.
Look. All right,
Stop.
Lauren. Don't give me
Uh-uh.
all the information now, Lauren.
Hold
How you
on.
doing,
Hold on.
Lauren? It's
Boo.
nice to meet you.
Boo. All right. All right, bruh.
She want to take over. She want to take over the show.
Low. Low.
I'm not gonna say it.
You gotta watch your tablet now. Watch your tablet.
That's what I did.
Yeah.
Hey.
Hey. I have to say, y'all actually asked some great questions from the doctors, bro. They actually gave some great info.
Yeah.
Right.
Uh, but the one thing, Lauren, I'm gonna take your tablet.
Uh-oh.
Okay. So the one thing I do have to say, they actually test every baby that is born just for drugs.
Hmm.
They test down in Louisiana. We test every baby just for drugs. Just if that baby even tests positive for anything, they actually got to call child protection.
Wow. So every baby born period is tested for drugs.
Correct.
Well, you know what, Courtney? My question when I heard Dr. Remy talking was just
And
about
I'm
the
gonna get under the cover.
Mm-hmm.
with the time that she was saying that the teenagers
I
is
want
living
my
in
milk.
right now in a drug of choice that they are having. You know, do you have a lot of situations to where you got kids acting up or you going to homes of kids that's addicted to drugs as teenagers?
Yeah, yeah, and actually one of the things we're having teenage pregnancies to where the baby has to be tested for positive. And here lately, we've been running into just kids. We've been running to the actual kids are just using drugs. You know what I mean? I mean, we got it to where the parents they don't have no knowledge of it. But then you have some of them. The parents are actually using the drugs with the children.
Whoa, wait, Courtney.
Mm-mm.
Wait. Explain that. I mean, for the people like me
Okay.
that's hoping I didn't hear that. Explain what you just said.
All right. All right. If someone was to call our agency, they happen to say that the mom or the dad is out there using drugs, that the children are using drugs with them.
Wow.
We've had situations to where they are roaming the street together. Yeah, they're actually roaming the streets together using drugs.
What?
Wow.
Yes. Uh-huh. They're actually roaming the street together using drugs. How we tried to find out is we will drug test both of them. And it came back sometime, both of them they test positive for the exact same thing.
Wow.
Um,
Wow.
um, yeah.
Man,
Courtney,
that's heartbreaking.
have you ever had a situation to where it was a teenager that was pregnant using drugs?
Oh yes, yes,
So
yes,
that
yes, yes. That
wasn't. I mean, that letter blew me away. That's not abnormal.
no, like I said, I'm gonna say probably this past summer has been on fire with it. I mean, we've been on fire with teenagers having babies, but they're testing positive. But the crazy part about it is we happen to run the children's history, right? So their parents don't have any history with us, but now they have history. They
Mm.
have history as a parent, and the issue is we can't hold that parent accountable for their child using that drug because most of the time when they do have that baby, that mother or father they don't know that their grandchild tested positive. But when they find out, they're actually mad.
Hmm.
Oh,
Hmm.
man. You know, well, what I'm tripping out of. You got a question for Courtney, right quick, Kevin?
No, I'm just listening.
Okay. Yeah. Well, what I'm tripping out of, Courtney, is I thought that would be something that was shocking to hear. You know that these teenage girls like they don't think about the effects that that's gonna have and how you popping pills and smoking while you pregnant. Like I thought that was probably was like an isolated case.
No, See, now the weed, the common answer we get from folks, the reason why they are smoking weed is because they believe weed is legal. We're like, no, weed is not legal. Then the other thing that they would say is they're actually using that just for the simple fact they cannot hold down their food. We're like, all right, we understand that, but there's other medications you can actually use. And and it's crazy, bro. Matter of fact, I'm trying to remember. I don't remember what it was, but I remember something blew my mind because this was the first time a child had withdrawal symptoms off of weed. But the problem was that weed was laced. Yeah,
Mm,
Gotcha.
yeah,
wow,
yeah,
wow.
We had a question about that earlier. Why do you think it was lacing the weed?
bruh, bruh. I believe part of it is you got to know who is it you're actually getting your drugs from.
Hmm.
Mm-hmm.
You know what I mean? That'd be a actual trust factor, because people have to be adding in these drugs now. They're adding in for simple fact they actually want their weed to be more potent. But the problem is, bro, you have people really out there like one person cried because we said you tested positive for fentanyl. There's like, no, my baby couldn't have. There's like, I've never done it. The person like, I admit I smoke weed, but we have to explain to them, yeah, you may have smoked, but you don't know what that person used. The person that sold it to you.
Mm-hmm.
Hmm.
So, and at the same time, when the parent found out, they're like, so my baby tested positive for fentanyl. Yeah, your baby tested positive for fentanyl.
Wow,
Wow.
dude. Wow, man. I mean, baby, you know what I mean? I don't even understand why people would put fentanyl on weed, dog. This shit don't make no sense. Why they even mixing this shit like that, dog? This is crazy. So you ever had to
Wow.
remove a kid from a home due to drug use?
Yeah, man. Yeah. I mean, it's the the one thing what people believe for child protection, we like to remove kids. Man, hey, bro, I'm gonna go ahead and keep it 100. Anyone know me, bro? I'm not trying to remove a child. I mean, it got to be something major to do it. And we've had some people, bro. They've literally had a baby was born with drugs, and then of course they have about three more test positive for drugs.
Damn.
So then it's time to just kept it going. Right.
Right. So and we've had situations to where uh matter of fact, you just made me realize we were about to get custody of some twins. The mom tested positive for some big time drugs, but fentanyl was one. The baby was born preemie. Both babies passed away.
Wow. Well, I mean, after she had him, oh, you saying it was after
Yes.
birth? Oh,
Yeah. No. No. She actually had them early. The baby, bro. The doctor told us those babies was gonna be in the hospital for 5 months. They said at least 5 months these babies are gonna be in there. Now the issue came because the baby tested positive, both of them tested positive for fentanyl. But the issue was the fentanyl, it had led to some type of sickness they had got.
Damn.
They got some type of rare thing to where, it ate their bodies up. So now we have to get custody of the other children. Now that we got custody of the other children, now the sad thing about it is the police is thinking about, do we charge this mom? Because for you to have that much fentanyl, you had twins, both of them passed.
I
We,
mean, was this an older
wow.
person, younger person using this fentanyl?
Bruh, 30s.
Wow.
So, Courtney, when you say ate their bodies up, you mean like eating up the inside, the organs, and
Yes, organs, bruh. Literally organs, bruh. Their organs were actually getting eaten up to where the doctor was like, there's nothing we can do.
Wow.
They the doctor's like, there's nothing we can do. We actually cannot stop this.
Wow.
Wow, man.
And it all stems from the drugs the mom had taken. So
Man, I ain't never heard
uh
that before.
bruh, like hey Kev, I'm keeping it real. That was my first time hearing it, seeing it, but like I said, nowadays we don't understand what fentanyl is actually doing. You know what I mean? Then there's different
Wow.
levels of it. So when people are using drugs, you're already using some potent things, but now you're adding that fentanyl to it. Now you might be able to handle it, but that newborn child can't.
Man,
You feel me?
yeah, I've seen working in surgery. I've seen babies and mamas on drugs that's some kind of organs born on the outside of the body, but I've never seen where it's eating them up.
Mm-hmm.
Yeah,
Mm-hmm.
I mean, bro, I'm not gonna lie. It is things are changing. You know what I mean? This
Wow.
the whole system is actually changing to where I'm put like this. People are now saying if a baby tests positive for fentanyl, they initially want us to get custody.
Jesus. And what y'all do with the babies? I mean, for everybody that don't know, Courtney work for CPS in New Orleans. He also is a counselor, a preacher. Courtney is everything, and mainly he's a friend of the show. So he's
Ex
our
football
resident
player.
person that we call when we need extra education on things that's dealing with um, child protective or anything that's dealing with kids. But Courtney, like dog, to have all this going on and you're seeing it every day. You know, I don't know when you came on the show, but the topic of the show is how do I convince my daughter and niece to stop using drugs while they're pregnant? Because we got 5 minutes left, and I really want you to talk to the mother that's looking on here right now. Speak to her. Tell her what you could probably do to convince the kids to stop, man.
What I believe the parent needs that they need to have that hard conversation with them. Tell them what drugs can do to them, but not only them, but that baby. And then along with that baby, because you have to realize when you have a child or a mother, that is a lifetime commitment. That's a lifetime commitment for you to take care of that child, and you are putting your child at risk to where your child they may have some issues. So it's one thing to be able to care for a child. We all know raising children is hard, but now to
Hmm.
raise a child that also has some problems, because also it also leads to problems. You also have the mental health problems. You will also have the physical problems. You know what I mean? So you have to try to let them know that these are serious things that can possibly happen to your child. You know what I mean? So you want to treat your body as a temple. Treat your body as a temple, you know what I mean? Because now you have a living creature, living being in you. And whatever you intake, that child is also getting too. Whatever bad nutrients you got going there, your child's getting. Whatever good ones you're getting, child's getting. But then the other thing is part of it is you don't want your child to come up in the system. Bruh, the one thing I always tell folks, I don't want CPS calling me for nothing.
Mm.
For nothing. And as it turned out, bruh, I'm gonna go ahead and keep it real with y'all. Somebody I know got caught up in the same situation. I warned them. I said, don't do this because CPS is gonna come knocking at your door. And guess what? CPS came knocking at their door, and of course they asked me, Courtney, what is it I can do? When I told you to stop, you needed to stop popping them pills. You needed to stop smoking because smoking weed and popping them pills, if that's something you can quit as soon as possible. Because the what the issue a lot of folks don't realize, the actual test for a baby, that happens to be that stool test. The first time that baby they actually take that stool, that's that happens to be the thing they actually test. Just because
Hmm.
that stool got everything you fed that child. So
Wow.
my thing is have that conversation. Let them know that you have to stop not only for yourself now, you have to stop for your child.
Mhm.
Wow.
Yeah, man. Like I said, man, that it was extreme when I read it, and I try to address it as it was extreme. That's why I had some doctors on here. That's why I got you on here, Courtney. I try to get some professionals on here to give out some educated advice besides me just feeling like a parent, right? And just having those type of thoughts and advice. But I wanted to bring on people that was educated in that background to give those uh to give their experience and to give their opinion. And you guys did great. For mom that's watching the show, I saw you watching. I hope I answered your question. Yes, I did not do the pepper letter, but I did um try to get an answer to your question. You want to know how to convince your daughter and your niece. Well, I had three professionals on here, three professionals, and the show was created just to answer your question, because I
Right.
thought it was serious. Just as you took it serious to write the show, I took it serious too. You know, God put me in this position for a reason, so I take it very serious. You know, so thank you for writing us. I really appreciate you. I hope we answered your question. I hope the guests that we had to come on give you enough strength and courage to be able to do what you need to do. You know what I mean? Once again, thank you, Courtney. Do we have any questions from for Courtney in the audience? Any questions for Courtney in the audience?
Let me peek down here and see.
All
Not
right, love.
a bunch of more comments. Question. Question needs child needs their mother attention now. Love.
He
That's
just
so.
don't want to read
I
it.
got a I got a question. I got a even though it's the same concept, Courtney.
What's up?
A lot of kids are doing it. What's the difference with these new vape weed pens versus actual weed?
See the problem with vaping, you actually you don't know what the quantity is. Feel me?
Right.
Because one vape pen can be totally different from the next vape pen. And these kids think vaping happens to be the easiest thing, but vaping happen to be dangerous. You feel me?
Right.
See, one of the things, bro, I don't knock no one for smoking weed. I don't do it. I don't do it, but I'm not gonna knock anyone. To me, weed is more natural. When you're dealing with something natural, that is that is that is easier. But these man-made drugs, they all have a side effect.
Right.
All drugs have a side effect. So the vaping causes more problem. I mean, cause the vaping have to be easier for them. But come on, bro. The only thing they got to do is grab a pen. You don't know what it is, quick. You know what I mean? But what they're not understanding is that is harming their bodies also. You know what I mean?
Mm-hmm.
That right there is harming. And then of course you don't know what all they have in it. So so the vaping have to be the newest thing. I mean, I think for us as parents, we gotta have this real conversation. We gotta talk to our children about drugs. You know what I
Right.
mean? We all used to joke and uh uh we used to see people using drugs. But nowadays, right now, bro, you see drugs everywhere. Come
Everywhere.
Mm-hmm.
come on, Brett. I ain't gonna lie. You could be driving down the highway. Somebody window rolled down, guess what? You actually
Right.
smell. You like,
Yeah,
you know what I
that's
mean?
smoking.
Right.
But then at the same time, bro, people have to be educated just about the consequences of drugs. See, it's one thing to look cool doing it, but it's another thing to find out the consequences from it.
Right.
Mm-hmm.
Right.
Mm-hmm.
Right. Right.
Oh, but the one thing that the parent also got to do, they got to teach. They got to have faith in something. Now,
Mm.
now I'm about to keep this. This ain't no preaching mode. This just me. We gotta have faith in something,
Mm.
and we gotta have faith in some higher being, because that higher being can get us through any situation. I may call my higher being God. You may call your higher being something else. Whatever you call your higher being, I really don't want to debate what you call it. But you got to have faith in something and teach your child to have faith. To know whatever hard situation, getting off drugs, you can actually get off drugs. You know what I
Mm-hmm.
mean? We got to have something for us to be able to look up to. Because one thing I'm going to say, I actually do not believe in luck. Come on, bro. You actually can't tell me you are more luckier than me. No, because my work and my faith, they both go together. They both go together. So as that parent, you gotta pray about that too. Because sometimes no matter what we say as parents, these children will not hear us. But you still gotta put forth that effort. If you put forth that effort, lean, and of course you gotta lean on your faith, hey, things will work out.
Mm.
And of course, we have to talk to our children just about that. I'm not saying this is about church. This ain't nothing about church. This is just about you as a person having faith in something. Because every single one of us on here had someone praying for us.
Correct.
We all know some of us, we wouldn't have made it if our parents did not pray for us, our grandparents. So we got to
Right.
do the same thing for our children. You
Mm.
know what I mean? Because
Right.
the whole
Right.
church thing, but like I said, we can have a whole conversation on that. That's actually, but I'm saying
And we
for
will
us
next
for
week.
us to be able to encourage our children to have faith in something, because there's so much negative influences out here. So give them something positive to be able to look at.
Hmm. Yeah, that's great advice. That's why I say you was perfect to close the show out. That's why I say you're a CPS employee. You work for the state, bro. You do your. He's also an electrician. So if y'all need an electrician in New Orleans,
Okay,
Coach
baby.
Courtney is also an electrician. Plus, he's a preacher, and that's why I say you was perfect to close the show out, man. Because I know you was gonna bring it home, and that's something that I was thinking. That honestly, you need to pray with these kids. You need to pray with these kids. So like when you pray with these kids, you teaching them how they can get through this without you, because you got to build them to be independent without you. You understand what I'm saying? So when you pray
Mm-hmm.
with your kid, right, you teaching them how to communicate with God, and you got to teach them how to
Exactly.
meditate. And when they meditate, that's God communicating with them. So it's prayer and meditation that go hand in hand. If you teach them that as they're growing in life, we all go astray, but we all know how to come back because we have a foundation. That's why I say,
Amen.
dude, that's the bigger deal within all this, man. We got so far removed from not necessarily church, but just from the higher power, the higher being, like Courtney said, whatever you want to call them, knowing that person exists or knowing that being exists. You
Right.
understand?
Right.
Go ahead, brother.
Right.
Thank you, Courtney. Thank you, brother.
Yeah. Which at the same time, same time, this have to be my last thing. That just it happened to be this grandbaby here. Y'all had saw. And first time I met y'all, I said one of my grandchildren, they had got shot. This is the grandbaby that got shot. A
Look at that.
45, 45 having to 45, it happened to hit her knee, and it happened to be on her ankle. My baby had just learned how to walk then.
Wow.
Bruh, that happened 2 years ago.
Wow.
She's 3 right now.
Wow.
This girl will do all types of dance you need, will do everything. Just the reason why I'm saying that is I had to have faith for her to be able to get through this. I had to have faith for me to get through this. Just because right now, bro, people don't understand that faith can get us through any situation we have. I don't care. It could be drugs, anything. I know
Right.
faith got me through this. And the most beautiful part about this, bruh, she lives with me. But the best part about it, she would tell me, we need to pray, Papa.
Wow.
We need to pray.
Hmm. That's good,
Oh,
man.
that's
We actually
awesome.
plan on praying, baby. All right. All right. All right.
That's awesome,
All
bro.
right. Come on.
Thank you, Courtney. Thank you. See, bro. Y'all already know, bro. We got Courtney on here. You know, this is the All Love Over Here show. We got you on the platform. I don't invite anybody on this platform.
Come on.
Courtney, I want to thank you. Let's thank him.
For
Let's show him
sure.
some love, y'all. Let's clap him up. Let's clap him up. Let's
For
clap
sure.
him up.
Always a blessing to see Courtney, man. Always a blessing.
Thank you, Courtney. Thank you, brother. Like I said, you was perfect, brother.
All right, Lo. All
She
right.
gonna talk.
Our
She gonna
Father.
talk.
No, since I said pray, she want us to pray.
Oh, let's
Go, let's
pray.
pray.
Okay.
Let's pray on it.
That's
Let's
that's
pray
the
on it. Let's
Our
go.
Which art in
Father.
heaven, hallowed be thy
All right.
name.
Hallowed be thy name.
Thy kingdom come.
Thy kingdom
My kingdom
come.
Thy will be done
Thy
I
will
will
be
be done.
done
on earth
on earth
as it is in heaven.
as it is in heaven.
Give us this day
Give us this day
our daily bread, and forgive us our trespasses. And lead us not
and lead us
into temptation. And forgive us. Oh
not.
Lord,
Our
made me forget
trespasses. Look,
our
yeah, yeah.
trespasses. And lead us not into temptation. And deliver us from evil. For thine is the kingdom, the power, and the glory. Amen.
Amen.
Oh
All
no! Oh,
right,
see.
Amen.
all right, all right. You did a
Hey,
great job, Lauren.
dog.
Great
Hey,
job, Lauren. Great
hey.
job. Great
All
job.
right. Love y'all, bro.
All right, love you.
Man, love
Thank
you,
you,
Courtney,
big
man.
brother. I appreciate you.
Salute,
Thank you.
man.
Salute you.
For
Thank you, big
sure.
brother. I
Yes.
appreciate you, man.
Oh yeah, Kevin.
What you got?
Kevin. Hey, I know some of your family members now.
So,
All right. So you better stop messing with me.
you know what? They sure did tell me. You know Courtney? I said, yeah, I know Courtney. Yes, sir. Appreciate you, man. Appreciate you looking
All
out.
right. All right. Love y'all,
All right,
bro.
love you too, big
Love you too, man.
brother. Thank you, coach. Oh man, this was an awesome, awesome show tonight, man. Let's thank the awesome couple, Dr. Michael O and Dr. Remy O.
Remio, that's
Thank
like a drink.
y'all,
Get
man.
that Remio on the rocks.
Thank y'all. Really appreciate y'all, and also thank you, Courtney, for bringing it on home for us, my brother. We really, really appreciate y'all, man. Thank y'all. To the parent, I hope I was able to help y'all, baby. I did the best I can do. Like I said, thank you for writing the show once again. I really think y'all are brave people to write this show, knowing Kevin is a part of this show. So,
Listen,
like I said, once again, I didn't read your pepper letter, but I still was able to answer your question the best I could. Thank you, thank you. Kevin, give me your social site so we can close the show out.
man, y'all can follow me at Cav the Comedian underscore 504. That's Cav the Comedian underscore the Comedian at 504 on Instagram. Y'all know me on Facebook. Follow me at Kevin Howard. On my All Love Over Here page. Y'all can follow me over there. Y'all can follow me. Also, go to our YouTube. Our YouTube page is growing. Really appreciate the ones that's the newcomers that subscribe. We really appreciate all y'all that's subscribing to the page. Every day I'm posting on there, making reels, I'm putting the videos. Every day I'm putting some on this on our YouTube page. So if you miss one of the shows, go to the YouTube page. You can find our older shows from last season and from this season. You know what? We got a third season. Man, that's a blessing. But yeah, y'all already know how I go, man. What you got, dog?
Hey, man. If y'all want any of the Beast gear, y'all remember you can holler at me at beastbiteeguiding.com. You want any of the fly gear, man, just holler at me, man. I got you. Anything you want some custom, y'all see I'm losing weight. My shirt's getting all big. But if you want
Yeah,
something
mine too.
custom, holla at me, man. The big brims that I make. Thank you to all the people that I'm making hats for. Thank you for everybody that I made a hat for. Thank you for the Beast family is growing. I mean, the artists coming in. I really appreciate y'all for helping making my dream come true. But as you can get the gear at beastbiteeguiding.com. Remember, I don't make regular wool. I make rabbit, nutria, and beaver. Rabbit, nutria, and beaver. I don't make regular wool. So When you call me, know you're getting something exotic, and it's gonna be the best hat that you have in your collection. I promise you. I'm a beast for real. You
The
heard me?
R&B hats, man.
Look,
R&B
man.
hats, y'all.
Look, holla at me. When you trying to look exclusive, shit, that's the time you need to be high in that beast. Thank y'all. I really appreciate y'all, man. I salute y'all. We gonna see y'all next
Oh,
Wednesday. Y'all already
y'all,
know. Well, I'm about to. You got something to say, my brother?
somebody asked me a comment. They said, "Call the electrician. Do you fix roses?" What that mean?
Coordinates. Electrician, do he fix the rose? Oh my God. Say, bro, this dude, no, you gotta go buy another little stanky rose. This dude here, dog.
Somebody in the comments said that, dog. Listen, for y'all latecomers, Sabrina Butler, I can call your name. I'm Sabrina Butler, come to the office. All y'all latecomers,
What's up,
we'll
Bree?
be New Orleans. We'll be New Orleans doing another live. Actually, let y'all donate toy for our toy drive for Christmas. Help the kids that are unfortunate that have anything for their day. So come in with a toy, get in the show for free. Buy a toy, get the show for free. Come see me, come see him, come see us like I asked. Y'all know how we get down. Also, we'll be in the Houston area in a couple of more weeks. Come see us out there. We might not be doing no show out there, but we still want to see some love. We still want y'all to show us some love. Y'all see us? Y'all want to take a picture? I'm charging two high shoes and $1. Take a picture with y'all. I'm telling
Y'all already know. What's the name of the show?
you.
All
All
over
love.
here.
Yeah.
We'll see y'all next week, man. We out this thing.
Salute.
Peace.